know you know.
Hey, Jason. 8.
I can try to track that down for you if you like.
I'm gonna proceed to check out and see if it says.
Am I hearing?
When they go to checkout, it says, try it Prime and get 1-day delivery on this order.
Right, so they don't, this account does not currently have Prime. We don't know why.
I'm confused. I'm hearing John Scholl's voice, but I don't see him in the meeting.
Same.
John, do you hear us? Oh, I see, because he's in my other Google Meet. Hold on, folks. I joined the Google Meet to see if anyone joined there.
Can you get
I
me?
did too. I sent everyone the Zoom link yesterday also, so I'll text John.
Okay, John's coming in now. Sorry for the delay. So I think we got everyone. Welcome to Maddie and anyone else I didn't say hello to. Let me pull up my notes from last time here and we can go ahead and get started. Okay. 1 second, let me just rearrange my video panel here. All right, so just a quick update of what's happened since the last time we met. We did have a meeting to follow up on the website development. So for any of you who maybe weren't here last time, or as a reminder, we did explore, are we sure that we want to go this new route, building this new site? Or do we want to take another look at e-NABLE Web Central and what could be done there? And we decided that no, that's probably not the way to go. e-NABLE Web Central probably needs to be retired. We are going to move forward with the new site. And we're going to kind of take it in phases. Phase 1 will be to get the site up with the content that we want to represent e-NABLE more generally, and to have that basic matching functionality with the forms for both somebody requesting a device as well as somebody offering to volunteer, get pins on the map, and have that basic matching functionality. That's going to be our phase 1. But we are already thinking towards then moving past that to add in more of the case management functionality, at least at a basic level, which means we'd have some rudimentary database, functionality in there, which we talked about maybe even incorporating from the beginning, just so that even those initial forms coming in when somebody requests a device or offers to volunteer, that can even be dumping that data into the database, just so that we have that for the later phases. And so in those later phases, we'd look at expanding on that and incorporating other ways of monitoring cases and reporting on case activity and that sort of thing, so that we're not just entirely dependent on email. But right now, we're going to focus on phase 1. We established a shared Google Drive folder with a Google document that Morgan is going to take a first stab at drafting a proposal for phase 1. We're basically going to document what we think is needed to get this going, to get phase 1 done. What are those work efforts specifically as far as getting the site up the way that we want? And of that work, how much do we think we can get done in a timely manner with volunteers? And then how much is left where we might need to go and look for contractors to help us get it done? We talked about wanting to have it up in the next 1 to 2 months. And so to get that done, whatever kind of help we need from contractors, we'll come up with some kind of a dollar estimate that would go out on Lumio as a proposal for the community to evaluate. I have no doubt that that'll get approved, given that we have the funding and this is an important initiative, and then we can go ahead and get this done. So that's our plan, and Morgan is working on that. Morgan, how's any progress there? Any help that you need from us at this time? We're able to get into that Google Doc?
I was able to get a Google Doc. Now I just gotta sit down and do it. I'm hoping to do that
Sounds
this
good.
weekend or this coming week. I'm also moving right now, so
Oh yeah, okay. And just I want to let you kind of take the first stab at it, but we're definitely here to collaborate on that with you. So once you get it, just
perfect.
a basic draft going, let the rest of us know. And what I'll do is after today's meeting, I shared that Google Drive folder and the Google Doc with everyone that was in our last meeting. But after this meeting, I will also share it with everybody that's in this meeting, so that you all have access to that. And it's a shared doc that we can all work on together to make sure that we have a common understanding of what we're looking to get done here and how much work that's going to take and where we might be looking for some outside assistance and need funding for that. So I think that's going where we want it to go, and we've got a good plan, and we'll be able to get that site up. So we'll have some good basic matching capability. Meanwhile, I'm happy to say that we do have 2 volunteers, at least one of which is here today. Jonathan's here. At least I thought he was. Is Jonathan still? Oh yeah, Jonathan's still here. So Jonathan is here helping us with case management on e-NABLE Web Central now. We also have another volunteer named Dirk Freeman, who's also helping us with case management. And so we have 2 people that are, at least as long as until we get the new site up and running, we still have e-NABLE Web Central there, and we have all these cases that were just kind of stuck going nowhere. So we now have 2 volunteers that are actively working to clear up those cases, either getting them moving again or closing them down if they're no longer needed, and just kind of cleaning that up so that it will be as useful as possible while we have to rely on it. So thank you very much to Jonathan and to Dirk for that. It's a lot of work, and they've both done a really great job on that. It's nice that we can keep that going as well as possible while we need it, but the plan will be to bring e-NABLE Web Central end of life once we have this new platform up and running. So that's the plan. Any questions on that from anyone here? Any comments, concerns, questions, anything like that?
I don't think I got the link to the Google Drive, so if somebody wouldn't mind.
Yeah, I'm going to send it out after this meeting. I'll send it to everyone who's here today. I only sent it out to the people that were in our last meeting, which was a subset. So I will send it out to all of you. I will do that right after this meeting.
Thanks, Jeff.
Jeremy, I just want to elaborate a little bit on how it's been going so far with the case facilitation. So part of the drive with the new website is to streamline things and make sure that we're getting feedback on our system. And I've had numerous conversations with 5, 6-year-old cases that didn't end up getting resolved, and these recipients are still looking for assistance. So I really think this new website is going to help close the loop on some of those issues.
Yeah, definitely. Yeah, I mean, we tried to, e-NABLE Web Central came at a time where we didn't really have anywhere near the level of active volunteers that we do now. And so we tried to really build a completely self-service platform. And it was a nice idea at the time, but, we learned a lot of lessons from it. And there were parts of it that definitely didn't work as we had hoped. And we ended up with a lot of cases that just never got the attention and the help that they needed. And I do like that this new system has that human element, that there are actual people handling the matching that can keep an eye on things. And once we get past phase 1 to where we actually are able to build in some additional elements to monitor the status of cases, to get feedback on, the people that receive devices and things like that, I think it'll be even better then, that we can really avoid, people getting lost in the process. So I'm optimistic about that. Anyone else have any comments or questions about the new site or the matching or any of that on that topic? So otherwise we can focus elsewhere today. Okay. Well, so then the next topic that we had, the next sort of major category of discussion was our design catalog. And let's see, we have Eric, but we don't have Ian, do we?
Ian teaches at this time, so he said he could try to join at the very end, but he's not sure about today.
So we might have to come back to this another time. We kind of ran out of time last time, where we ran into a little bit of a difference of opinion, where Ian was, wait, am I getting it confused? Who was the one that was saying that they use the Phoenix device a lot? Was that Ian or was that somebody else?
Well, the issue was, no, that
Thierry
Thierry was
Thierry
promoting.
yes.
the Phoenix, and Eric was saying, yeah, but it doesn't meet my high standards.
Okay, so we do have the two people that we need for that discussion. I was mistaken before. So I wanted to allow some time today to further that discussion, because Thierry is finding that the Phoenix hand is sort of their go-to in France, and they're using it quite a lot. And the question was, okay, well, why isn't that in the printables catalog if that's supposed to be our most recommended designs? And Eric was talking about sort of the standards that he's been using to determine which ones we present there. And he found some shortcomings with the Phoenix design. And so I don't think there is one right or wrong answer to this, but we do have to see if we can agree on some kind of guidelines of, what constitutes a device that would make that cut, that would be presented in that printables catalog as one of our recommended designs. And, if once we agree on what those criteria are, well, then, each device can be evaluated based on those criteria. And I don't really know where to go from there, but let me just kind of ask maybe Eric and Thierry to each kind of give your perspective on this, because we were a little bit rushed last time. So maybe I guess we can, it doesn't matter which we start with. Let me just go to you, Eric, and start with your feedback about why you chose not to include the Phoenix hand and the unlimited arm in that group of devices.
Yeah, so I do some tests. So the tests that I do the box and block test, and I put that up a couple years ago about how to do that, so anybody can do that one. And it's just picking up blocks and moving them, and I see how good the hands do with that. If they get up to something that's similar to a poorly performing commercially available device, so that's about 20 blocks or so, then they pass that test, and the Phoenix devices do pass that. So they pass that benchmark. And then I kind of stress test them, where I stick them in a machine and just have it bending, doing cycle testing, bending the fingers, bending the elbow, and see what happens if they survive about 1,000 cycles. And I find that the Phoenix arm and the Phoenix hand, the rubber bands start to degrade, and they don't survive a bunch of cycles in the testing. So
what do you have some kind of like maybe an average of like how many cycles on average it takes for those to start to break down?
It varies, probably about 600-700 cycles, and they start to degrade and lose their elasticity. And then talking to people that have used them, I've sent a few out to other countries, not nearly as many as Thierry has done, I'm sure. And the information I get back is that the rubber bands degrade in a couple months of use in the humidity. Okay. So that's just what I find. And I have small numbers. So
right.
I'm doing testing in a lab. Great. But I think real world testing is much better. So if Thierry has lots of data and they're providing these devices and people are using them and they're getting good outcomes, that should rule over everything else.
That's what it's all about ultimately, right? It's the outcomes.
So
let's talk about that. So Thierry, tell us about what you're seeing. How, tell us about what you hear from people that you're making these devices for.
Well, first of all, I say we do a lot of Phoenix for historical reasons. First, because it has existed for a long time, because our validation process is based on the Phoenix. So it is the hand we ask the makers to make to validate them.
Okay.
Which are both absolutely no good reasons to use the Phoenix. I do totally agree. Then on top of that, it's very easy to print and build. So that could be a good reason, because it's cheap. It doesn't require any specific skills like printing a TPU for the kinetic. And I'd say this is it. It does work as far as we can see and the feedback we have. We are very bad at following up with our recipients once we have delivered the device. This is a big rock in my garden, and we're going to work on that sometime. But not sure what else I can say.
So Thierry, are you guys, have you made kinetic hands for people?
We are doing more and more, yes.
Okay.
It's growing up on us a lot.
What about for the arms? Have you done any of the Kwawu arms?
No, no.
Okay.
And that was my question for you, Eric. Do you have what would be your suggestion for arms?
Yep. So that's what I put on printables. It's the Kwawu, because it has been more rugged in my testing, and where I find the unlimited arm breaks is usually, well, the rubber bands in the fingers, but also the elbow hinges, the pins. They tend to break pretty easily, even if you thermoform everything correctly. And I've been doing it for a long time, so I'm pretty good at doing it. The pins do break. That is by design, according to the creators, right? They want to make sure that it does break if the load is too high, before there's like a catastrophic explosion. So they don't want you to use metal pins. But yeah, I find it breaks. So it's just not thick enough in the plastic, no matter what kind of parameters you use.
And what has your experience been, Eric, of assembling the Kwawu arm compared to the unlimited arm? How do they compare in difficulty in terms of that process?
I think they're all about the same. Theory makes a good point that the Phoenix is easy to assemble. So is the Phoenix arm, because you've been doing it a lot. So that makes it pretty straightforward. The Kwawu seems a little harder, but I think that's because the documentation for it is super, super thorough. So it walks you through. So it looks intimidating. Same with the kinetic. My students are afraid of those because it's this big book. But that book exists to really tell you exactly how to do it. So once they've done it a couple times, it's much more straightforward then. So I do run the tests. One test I run is, can my students figure it out? Can my mediocre students figure it out? And if they can do it, then it's probably a good documentation. So the Phoenix does have good enough documentation too. I think it would pass that benchmark. So if it's getting good outcomes from people, then I'm happy to put it up on printables.
About the rubber bands, I would like to say that I totally agree with you, Eric. They tend to break very easily. Yeah. And when we deliver a Phoenix, young users probably wear them out on a daily basis. But these rubber bands can be bought by the 100. They cost almost nothing, and at least in the Western world, are easy to find. So we do not. I try not to deliver Phoenix with rubber bands in hot countries, and I would not suggest that, because that's too complicated to find in Africa or in the south of Mediterranean country like Morocco, Tunisia, and so on. But in Europe, they are very easy to find, and they're also very easy to replace. So I don't think that's an issue for us.
Yeah, so it might be reasonable to publish it on printables with the caveat of where it's useful for, right? I tend to be sending more devices to Africa and to Pakistan are the main places, and those are hotter, and rubber bands are harder to get.
I know that on the goal with printables, or at least what we had talked about, is that our collection on the NIH 3D Exchange might be a more complete collection of everything, including experimental designs, with the ability to filter using all sorts of filters on the left side to kind of find whatever you need in that catalog. And the idea on printables is to present only those that are really fully baked, have really good documentation, have proven good outcomes, etc. On printables, is there any is there any mechanism for, I don't know, highlighting like primary or secondary designs, or like most recommended or alternative designs, or is it just one, like, is it all kind of at one level on printables?
It's mainly all at one level. I could do just in the title something different. I can designate this is well documented, but not appropriate for hotter countries where you can't buy rubber bands.
I mean, it almost sounds like, what I'm hearing is that the Phoenix designs are good. I mean, they're both good at certain things. I mean, maybe if we can figure out a way of presenting it like, hey, the Phoenix hand is a good one to start learning on. If this is your first device you're ever making, make a Phoenix. If you're looking to make a design for an actual person that you want to have the best quality possible, make a Kinetic. Maybe there's a way of presenting them for different use cases. I don't know. John?
Two questions. One is, did the rubber bands degrade if they're in a Ziploc bag over time?
They don't seem to, because that's how we keep them. We buy them in bulk, and they all come in these little Ziploc bags. And I actually had my partner pull some out when we had this discussion last time. We pulled some out from inventory. They had been sitting there for a long time, and she said no, she didn't find any that were degraded. So I think it's only when they're exposed to the elements.
So I'm just wondering whether if there's a place in the Phoenix hand, a little compartment where you could slip a small Ziploc bag with a few hundred rubber bands, and it sort of, you had the replacement drawer part of the designated deliverable. Just one other sort of short-term fix here to bridge the gap. I think I mentioned this last time, but I think that a relatively small design change would allow one to use the right metal spring in place of the rubber bands. And my intuition is that you could find a spring off the shelf, not too expensive, that would have about the same stretching characteristics, but would not degrade over time.
Well, there's two challenges with that, John, I think. First of all, we talked about this last time. I guess there's two different kinds of springs. I've never worked with the kind that would have a pushing action that you'd put on the underside. The kind that I have worked with are the traditional kinds of springs that would have to go across the top of the fingers to actuate the reverse action. The two problems I found with those is, number one, because when the fingers bend, the way that those springs get pulled, it's hard for me to describe, but they tend to kind of they don't really stay centered. They tend to fall off to the side.
You'd need to change it so there was a channel that they were settled into.
Which leads to my other point.
I think it's a relatively simple design project for someone who really wants to get into the design.
Yeah, it would be a design change, because you'd have to put in like hooks, places for the springs to hook into and channels for them to rest in. So it's a possibility, but that would be a different version of the Phoenix to do that. Yeah.
Okay, my third question is whether this is actually the purpose of this meeting, is to talk about this particular topic.
Well, you might be right. I mean, the only reason I wanted to go into this a little bit is because one of our high-level topics is just how we establish a design catalog that instead of having, right now, we've got 3 different versions going in 3 different places. And part of, we seem to come to an agreement that we want NIH to be the big full catalog, and we want printables to be the filtered catalog. But I don't think we fully agreed on just how we, what is the guideline for that.
Fair enough.
So maybe we're going too far. Maybe this could be taken off into a sideline conversation. But I feel like already we have a better sense of at least how to move forward. I think the goal here is to probably eventually eliminate the catalog on the hub. That would be replaced with the NIH 3D Print Exchange once Ian's team is able to get that fully populated and get the filters set up the way that we want. And then we'd have these 2 catalogs, the NIH and printables. And then it's, maybe there's some further discussion to be had of just how do we decide what goes into printables. I guess for now, I mean, we can leave it at this. There's been some good discussion. I think since Eric took the lead on building out printables, and he's the one taking responsibility for that, I think maybe it's appropriate to leave it in his hands. He can think about what's been discussed here, and based on that discussion, you know, I know I'm comfortable letting him decide what does or doesn't get added there. Because these designs will always be available, you know, on the other catalog in NIH, and we can direct people there as needed. So maybe we leave it at that for now. Eric or Thierry, do you guys have other comments or thoughts on this for now? You're muted, Thierry. You're muted, Thierry.
Yeah, sorry for that. I have one additional question. The Quavu arm is not usable by a person that has a very small wrist and hand. So what device would you suggest then, Eric, or collectively, do we have an alternative to the unlimited arm in this situation where you have a very small palm to integrate in the device?
So yeah, for that situation, I've helped a couple people, and I just do a bespoke device. I combined the Quawu arm and edit it a bit so that it can accommodate the wrist motion with a kinetic hand. So
with a kinetic hand?
Yeah. So
interesting.
I have a Quawu-netic.
Is that
got a ring to it?
Yeah, I mean, is that something that you think would be worth sharing, or is it the kind of thing that needs to be done on a one-off basis?
So currently it's always a one-off. It's not a parametric design. It's not something that scales nicely.
Okay.
And I just haven't had time to do that. And my students they don't know enough CAD to do that themselves yet.
Have you done one of those that was at a smaller scale?
Yeah, so if I were at work, I could show you. I've got one at about a 80% scale, a Quawu-netic, I guess.
So, I mean, even if it's not really ready to fully share publicly, maybe you could just share that particular set of STLs with Thierry for him to take a stab at.
Yeah, I could see what I can do when I get access to those files again. It was a student project, so they have it all.
Okay.
So
sounds interesting. All right, well, let's leave that for the time being. It is a work in progress. We'll get an update from Ian next time. I believe, what did we hear last time? That his student had been gone, but was back now and was going to be able to start working on that catalog again. I think that's what he said. So we'll have to find out if there's been any progress on adding the rest of our designs and then working on the filter options that are in there. But I know that's the goal there, is to get that to be a complete catalog that can be filtered down based on a variety of criteria. So then we can talk about the other topics that I have here are outreach and then grants and fundraising. So on the topic of outreach, I think one of the things that we talked about is that when we've done outreach in the past, when we've tried to reach out to partner organizations, one of the areas that we've struggled is just, you know, how do we present who we are? And so I think this kind of ties back to our other initiative, going back to the first topic of building out this new website. Because if we do that right, we then have a really great website that will clearly present, you know, what e-NABLE is about, what we do, what our impact has been, how people can get involved, et cetera. And that then becomes a tool that we can use in our outreach efforts, because we can point people to that new site where they can more readily, you know, see what it's all about and find opportunities for partnering with us. Wish we had Adam here, but for anyone else here, I don't have this topic very well defined. Does anybody have any thoughts about outreach and partnering in general, or any updates on specific partnerships that are being explored or developed? I know we talked about a couple in the last meeting, but those are in the early stages.
I know Temple's prosthetic program is trying to get involved and become a chapter. They're currently trying to make the Phoenix hand. They're printing everything. They have all the stuff to make it.
Remind me, Morgan, is that the chapter at your school?
Yeah.
Okay.
Well, my old school.
Got it. Okay. And so are they looking mainly to sort of be in device production, making devices for people?
Yep, and any other projects you guys need. So things like the website, they can help with anything really
Oh, okay.
across the whole thing.
Excellent.
cool.
Okay.
They're
Yeah.
looking for
Which
anywhere and
school?
anything to help. Temple University.
Okay. I'm just reminded that Drexel is trying to restart a chapter right down the
nice.
road from Temple. So you might want to reach out to them.
Yeah, I'll tell them that. But so what does that look like for them to become a chapter? They have the Phoenix hand printed, they're assembling it, and they're in the process of that, and then from there, what do they do?
So if on our chapters page, we have some instructions, it's below the chapters map, and we have step-by-step guidance down here.
Cool.
So
Okay.
we basically want them to get approved as volunteer makers, be familiar with the code of conduct, get your group together, choose a leader, create a test hand, and submit it for approval through our badging system so that we can have somebody actually make sure that they're putting it together properly and that it works properly.
Yep.
Get their badge for that. And then we have an intake form where they fill out a bunch of details about the chapter. We do want them to have a chapter Facebook page set up or a website. It's just some way to be able to be findable. And that's part of this intake form is we ask them to share those details about their chapter and that Facebook page and things like that. And then there's a badge that they request for being an e-NABLE community chapter. So it's a combination of that intake form and the badge. They kind of go together. And once I have those submissions, they'll be added to the map as a chapter. It's pretty straightforward.
Perfect.
Yeah.
All right. Well, in the meantime, am I allowed to have, like, if I have a project that I could use their help on, would I be able to have them help?
Oh yeah, there's no real, there's no real oversight on this. Being a chapter is entirely voluntary, and there's no problem working with somebody that's not an official chapter. It's just a way for us to, provide better visibility to get them on our map. But you're welcome to work with anyone. Absolutely.
Cool. All right, cool.
So I wanted to mention I'm talking with one of my colleagues who works for a company called Presta-Cycle. And they develop very high-end bicycle tools, small ratchets and things of that sort for titanium framed bicycles and really high-end things like that. And he said that they would be interested in donating some tools to e-NABLE, perhaps something that could be offered on the store as part of the packages. If there's specific torques that we're recommending for any of these models, these tools are capable of being dialed in and all of that stuff. So still working on that. And then of course we could laser engrave the logo, the e-NABLE logo on all these tools, so they would actually be
nice.
Yeah, very nice.
Still working on that.
Yeah, that's an interesting idea. I mean, the tools that we usually use for assembly are pretty basic. I personally, I've never gotten in any kind of torque wrenching or anything like that. It's pretty basic screwdrivers, needle nose pliers, things of that nature. Those are the two primary tools, actually. I would say it would be the needle nose pliers and a Phillips head screwdriver.
And they have some nice hex sets as well.
Yeah.
Because I know that a couple of models I've assembled had hex heads on the screws.
Oh, okay. Yeah. Yeah, I mean, we've never offered the tools. We've offered the material kits, but we've never offered the tools just because they seem to be the kind of things that people could find anywhere. But that's certainly something that we could explore, especially if they're looking to donate some of that. The materials kits are offered through my company, 3D Universe, so it's not technically e-NABLE that's offering those. It's 3D Universe, but I'd be happy to talk with them if that's something that I could help facilitate, even if it's just offering them as a free purchase that people can request through the site or something. I'd be happy to do that if that would be of interest.
Okay. I'll keep everybody posted.
Yeah. Okay. Thierry.
I was thinking everybody owns a screwdriver, either straight or in a cross, and hex keys are very, very easily to find. But there are tools that are less frequently found in every household, like a deburring tool that could be very useful in 3D printing. So maybe you could think about proposing that kind of tools.
What kind of tool?
A deburring tool.
Oh, a deburring tool. Yes.
Deburring tool. Yeah. It's something like that, and it's used to clean up the prints after printing.
Yep. Yep. And little files I find are handy also. Small thin files, things
Yeah.
like that can be useful. That's a good idea. Okay. All right. Well, let's broaden this topic a little bit. We recently were lucky enough to get some really nice funding. We got $100,000 donation from Aero Electronics that is available for helping us with strategic initiatives. And I'm sorry, Eric, I just saw that you raised your hand, so I'll come to you in just a moment. And in our earlier meeting today, Jason reported that he's got 10 active grant proposals out there right now. We don't know which ones will come through, but there's the potential for $400,000 to $500,000 in funding collectively between those. So I guess I would raise the question of what are the sort of the initiatives that you guys think we should be thinking about if we have these sort of more significant amounts of funding available. What would be of most significant benefit to the overall community? What would have the biggest impact? How can we best make use of those funds? And before I kind of open that up for discussion, let me go to Eric, who had his hand up.
So yeah, I'm working on a couple of outreach things. I'm working with Prusa still. In addition to Prusa printables, working on their resin printers to figure out how to make partial prosthetics with those. Because I think you can get much finer detail. Doing a new linkage-based design, so this is it. And I actually have a student that actually is missing his fingers. So is share screen enabled by any chance?
It should be. Let me stop mine and let me check to make sure that you have permissions.
But
now you should
but
be
while
able
you're
to.
on camera, show me that again, please.
Let me let you see my horrible, disgusting home.
Your
Let's
lighting
see.
is quite weird right now.
Yeah,
It is.
a lot
It
of
is.
backlighting.
Yeah, it's got a big
Yeah.
door back there. But there we go. So this is a linkage-based design. So it's entirely biomechanics driven. So when you bend your
Oh.
finger, it actually bends the finger itself. What's more important, who cares if I show it to you? Let's see it on an actual person. So this is the student. So you can see him. He has his medial and his proximal digit. And then the proximal is where he gets the socket that fits, and then the medial just pushes on a little bar.
Wait, are we seeing your screen right now? I seem to have lost it.
Yeah.
I see
we
it.
are.
I had it.
Oh, okay. Then it's
Yeah.
just me. Okay.
So there's
Sorry.
4 different
Is
pictures.
that the Nick's finger?
I see it now. Okay. My
no.
video is covering it.
This is a completely different. This is the design that I was showing. It's
I didn't know if it was based off the Nick's.
A maker
Cool.
out of I don't know where he's out of. He just published it. I found it on Reddit.
Sweet.
So I'm gonna adapt the design so it's parametric, so it'll work with more sizes a little bit better. But this is a student. This is his finger now. He's testing it. He bends his finger and everything closes.
Yeah, I've met a guy in France with a very similar design. So maybe it's the same. Maybe it's just the same idea reused. We had a problem. We tried to make it, and we had a problem with the rounded bar at the top, which was very fragile. How do you solve that?
I'm using tough resin right now, and that has been working pretty well for him, for the student. I've done it on the Prusa SL1S resin printer, and then I've done it on some Anycubics. The Anycubics, it cracks, it breaks, because they don't have good dialed-in profiles. So what you need is a really good dialed-in profile, I think. And then I also did just get a desktop CNC Carvera, so I should be able to carve it out of some aluminum potentially, and use a 4-axis kind of milling machine to mill out this finger for him too. And like I said, he's using it every day, so he's really putting it through the ringer and giving feedback, what's good, what's bad. We found actually blue plastic thimbles. It's like a silicone thimble. My wife hates them, so she said you take them in, and we use that as a liner, and that's been super comfortable for them. So this is pretty cool, and Prusa is excited about this because I can say, yeah, the Anycubics are awful for it. Use the Prusa. But it seems interesting. We're also experimenting with doing the flexible socket interface here with their flexi resin. So we're having some good progress there as far as partnerships. And then I'm also working with a Nigerian startup called Dynalim that released some 3D files for their version of a sax foot. So I'm assessing their 3D printed foot using some engineering equipment. But that might be a way to get e-NABLE started into doing some feet. Just figuring out how to do that safely and getting some good results there. And I think both of those are potentially interesting avenues for grant funding too, because it's taking us
If you
up a
need
notch.
anyone
There's
to
theories. Yeah.
test any of the Prusa printers, just let me know. You know, I'll sacrifice for the team.
Yeah,
I've been dying to get my hands on the other Prusas. I have a Prusa MK3.
Yeah.
And been saving up for the other.
Yeah, Theory's got it right there.
Yeah, nice.
Happy to share. Yeah, so Theory, is that printed in resin or was that FDM?
You're muted, Terry.
Again, yeah, I'm sorry. That was nylon, printed nylon on a powder machine.
Oh.
So it was more robust because this small part, rounded part on top, is very fragile. I've also tried to have one made in metal by using an online vendor of metal things. But then
Maybe
it
might
needs
be
to
worth
be
trying. Might be worth trying nylon carbon fiber because the carbon fiber adds a little bit of rigidity to it, so it'd be stiffer.
So it's a very, very
It
clever
almost
design.
looked like an SLS print.
Yeah, it looks good.
Like just from my camera.
Yeah.
Eric, is that the same design or the same concept?
If it's not the same design, it's very, very similar. I suspect it's the same.
Okay.
Yeah. So we're playing with that and
That's
working
very
with
interesting.
with
I'll
Prusa on
just
that.
point out that if we can come to really understand mechanical linkages, they would be useful for wrists and elbows as well as fingers. So Jeremy asked a question about strategic directions. I'll begin by saying I see 4 areas. Obviously, the platform is one of them, the website and the matching system.
Yep. And I don't think that's going to be a significant portion of that funding, but yeah, that's a small part of it.
Storytelling and tracking, which to me, the only kind of tracking we're likely to do is going to be by collecting stories, is another area that we could develop. And then outreach, systematic communication with interest groups like the Amputee Coalition and so on to develop a pipeline is another channel. And finally, beyond prosthetics or beyond hands. As history, as luck would have it, we've attracted lots of people who are particularly interested in the notion of making a mechanical hand with a 3D printer. But as we discuss almost every week, there's a lot more things you can do with the 3D printer, and there's a lot more things that makers can help with that don't involve 3D printers, like assistive technologies and so on. And
I'm working on a project right now for one of our, I don't know what you want to call them, patients that have reached out through Web Central for the forum. And it's not going to be 3D printed, but it kind of goes along that financing pillar.
Uh-huh.
It does involve materials, and I can't afford the materials, so and that's why I'm trying to partner with Temple University to see if they'll help. Their club will be able to have the funding to buy those materials, but that could be another thing we could have use for those financing opportunities. Any materials or
Right.
Well,
and the
exploration.
other thing we could think about, obviously, is we have the e-NABLE fund mechanism, which is meant to support volunteer-made, volunteer-offered proposals. But actually writing a proposal seems to have been a barrier. And so thinking about a way of facilitating or having someone on staff whose job it was to help someone like Morgan, not that Morgan needs the help, but help someone
No, please. I do need the help.
analogous to Morgan, but without the ability to write a proposal, sort of put together a proposal and plan that could be funded and perhaps overseen by that person.
If I can add,
I can help anyone with writing. So
right. Well, so that raises
can...
another question. Currently our paid staff consists of half of Sarah. And then there's Jason and Adam who fall into a somewhat different category. Do we have enough staff, or is this the moment to say it's time to stop expecting Jeremy to be able to juggle everything that breaks whenever it breaks?
Well, my first thought kind of goes back to Sarah. Let me ask this question: Is more than half of Sarah available as an option if we wanted to pursue that?
Yes. Not full time, but
Okay.
2/3 of me is
Well, so I'd say
available
that's worth exploring then, because we already have two things that we know that we could be, getting from Sarah that we're not right now. One, she just mentioned that she could help with, people that need, assistance documenting proposals. And we talked earlier about her interest in putting together and like I think we called it an issue brief, basically a pamphlet or a flyer to present e-NABLE and our impact. And she's done really nice versions of that she showed us an example. Just between those two things, I think there are interesting opportunities. So maybe just looking at increasing, how we're working with Sarah. And that doesn't take away from what John's saying. Maybe we also explore, do we need, others doing paid work? But I think starting with a known element that we have, we could maybe expand on what we're doing with Sarah. That would be of interest.
I would absolutely be open to that.
Okay, then let me absolutely demand that you sketch what that would involve, right? What would you do with your extra 16% time? And what would it cost us? And anything else we need in order to normalize that? It's not just that you're good, Sarah. It's that you're now the repository of a couple of years of experience. So you're a really valuable contributor who we've already invested a lot in. And if this is an opportunity to get more out of it, you shouldn't be shy.
Okay.
And I added, so I'll just say one more note on that is I think you should approach that as a Lumio proposal, Sarah. Let's put together a proposal for that additional sort of expanding on your current role. And we'll put the funding request in there and we'll put it out there to a vote and it'll get approved. I want to point out that I added one more item in here, which is marketing campaigns. When I look at over the last number of years, where I feel like one of our biggest shortcomings is we seem like for a long time, we've had an imbalance where we have many more volunteers than we have people coming to us asking for devices. And that's certainly not because there aren't people out there that need them. It's because those people that need them haven't found their way to us. So I think one of the things that we need most is more effective marketing to just get the word out to the community at large about, hey, we're here. This is what we can do. And we do it for free. Just come and, and talk to us. And I think we should think about it now that we have funding. you know, maybe it's a time to think about doing it right, you know, hire a marketing firm that does this, you know, put together a strategy and get marketing campaigns going so that we can do it right.
You know, that I completely agree with that. That's exactly what I meant to get at when I said systematic outreach, not to like-minded organizations, but to disability organizations.
Ah, okay.
And as part of that, this goes along a bit with the discussion, but for the marketing, and we had the idea earlier of supporting potential supporting supplies for some of these printing materials, right? But if you look at the current state, we have a small army of volunteers that are on the bench that are waiting to assist, right? One of the places my mind goes to is this sustainable source of funding. Is there any interest in using or leveraging that small army of volunteers to produce something like a 3D printed hand that holds a pen on a desk that we could sell on something like Amazon and actually have income for that? And that way you have sustainable funding in addition to the outreach, in additional to the marketing.
That's a nice product idea, I have to admit. A little 3D printed hand that is also a pen holder and is, you know, holding it in place.
Everybody loves desk accessories, and we've got the bandwidth, we've got the volunteers, and some of this funding could be used for the supplies for it. I've got folks that sell things on Amazon that are very experienced in that space, so I can approach them to kind of pick their brain. Of course, it's a whole supply chain thing that we'd have to arrange, but perhaps some of that funding could be used for not only those printed materials, but someone that can manage the delivery and supply chain aspect of that. I think that is a long-term source to continue to generate income. Now, I can't design it, but
right. That's actually a pretty easy design problem. If you already have a model hand.
I'm just seeing in chat that Eric mentions that R&D, putting funds towards R&D would be potentially good use of money as well. Talk to us a little bit more about that, Eric, and how that might look. If you're there.
So yeah. I think pushing designs forward, right? We had the Phoenix, and we had that for a long time, and that moved on to, well, I think that moved on to the Kinetic and the Kwawu. But keep identifying these problems again with some of that systematic outreach and some of that tracking and follow-up will give us data on how we can keep improving it. So keep improving the designs, make them more functional to get better outcomes. And also funding and researching the partial prosthetics and maybe starting to move a little bit into feet. I'm figuring out how to do feet. That's probably a significant expense because I think you'd want to bring in some medical professionals, some prosthetists. When e-NABLE first started, prosthetists were no way, we will never touch anything with 3D printing. But now you are getting a lot more motion with a lot of people being more willing to do that. And kind of this model of decentralized prosthetics manufacturing. I think that's how you start to meet the need and funding some efforts to figure out how to study how to do that and start implementing it. I think could be a big impact.
So do you see that as being something that would be done? And I just want to point out that we're into our last few minutes here, so we'll have to continue this next time. Do you see that as like sourcing the people that would do this actual R&D work? Do you think those are people within our community that we would look at sort of directing funding to in exchange for certain commitments of doing certain work? Or do you see this as being outside professionals, or like what is it that you had in mind?
I'd see it as into internal people.
Okay.
Maybe internal people with the right expertise.
Right.
I don't want to go to an external engineer that's going to do things their way because they don't understand everything
what we can do. Yeah.
Right. How we work. So you need somebody with that understanding, but also I think some technical knowledge.
Okay. Well, maybe this is a good point to wrap it up for today because we are at the top of the hour. And I think we came up with a really good list of ideas here about how we might be able to put our funding to good use. And maybe that's the focus next time, is to drill into some of those and start moving towards some well, I was going to say decisions, but ultimately moving towards the decision would be which ones of these do we document and put to the community to vote on. We're not going to actually make the decisions, but maybe decide on which to pursue. As far as at least writing them up for proposals. So
And
we can
one more quick thing, Jeremy, and I don't mean to keep people, I was just typing it in the chat. If we could just list it out. Last week, we talked briefly about video production and what that might do to help marketing initiatives. I'm, of course, happy to provide post-production services for that, but it might be good to hire a videographer and perhaps a producer to go to some of these events and really capture some of those success stories, just to get some of that raw footage, that B-roll footage that we could then edit into more of a story, to perpetuate our ideas and what we need for the e-NABLE community. So just an idea. Like I said, I wanted to get it on the list there before we wrap.
I know some great visual journalists who may be open to freelance work. If that's on the table, and maybe next time. But I also wanted to talk about storytelling and what can be accomplished remotely and over Zoom and what needs to be in person.
That's great.
And the resources involved in that.
Cool.
Okay, I'll add that as a note there, and we can talk about that more next time then. So great. I think that's a good point to wrap up then. This is a great discussion today, everyone. Thank you. We've got a lot of good ideas here that we can pursue next time and then start deciding which ones to pursue, since we do already have some funding to work with, so we can actually get going on some of these. So thank you all. I think we're gonna shoot to just keep the same schedule if that's okay. So 2 weeks out, right after that town hall meeting, we'll do the same one. Can I ask you to send an updated invite for that, Sarah? And let's use this Zoom link.
Yes, of course.
Okay. Thanks, everyone.
Thanks, everyone. Have a good weekend.
All right. Bye.
Bye.